Ayurveda, and how do they see the value of it in integrating it with NHS. And for this mapping exercise, which is initiated by the Ayurvedic Practitioners Association, it's a very small association. There are very few members, but they have put together £12,000 of their own membership money to map out Ayurveda in this country. But if we can join hands with other associations and academics, we possibly could then have a document and a good data which describes the prevalence of Ayurvedic use in this country, which describes the characteristics of people who use Ayurveda, which then can form the basis for all our discussions. Otherwise, we will be going back to rhetoric, which may not actually take us to the next step of implementing. Because I can tell as a practitioner, there are hundreds of patients who are really seeking to integrate Ayurveda with the usual healthcare. And GPs are not always against it. I have spoken to a lot of GPs and specialists, I work with them, and they say the problem is we don't know where to refer their patient and how can Ayurveda be integrated, particularly in palliative care, in cancer, in autoimmune conditions, where we see that from a public health perspective, actually there are many lifestyle factors which are even more important than necessary or the sufficient cause which leads to these conditions. In many instances, we don't even know what's actually causing these conditions, although we are very good at diagnosing them. And therefore, I think, it is very important that we understand what Ayurveda's role is in this country. For that, we need the support from the Indian High Commission, we need support from NHS, we need support from politicians like yourselves and academics and practitioners. So unless we actually go out of our very clinical-minded, small focus on clinical care to the population health and public health and look at the crossovers between the end user, the patient, or the individual who wants to be healthy, healthcare providers, practitioners, and research, I don't think we will see a change. We'll still be talking about it. So I hope that the Indian High Commission will stand behind initiatives like the survey and help us. Thank you.
Thank you. I must say that we do need to have the input from parliamentarians. And one of the ways, of course, is that wherever you reside in your constituencies, go and speak to your Member of Parliament. That will give you a good indicator of how much engagement you will get and raise your concerns that if it's not going to get the right sort of interest, that there are other parliamentarians who will. So I think it's really about making sure that politics works for you. Yeah, so Richard, could you read the EDM that Brenda Sharma... we don't... Have we got a copy? We have. Right, of what was laid on the 17th of October in the House of Commons. Now, we don't have EDMs in the House of Lords, otherwise we would have been able to lay one down too.
Thank you. Early Day Motion, EDM 418, Ayurveda Day 2017. That this House recognises the second Ayurveda Day on the 17th of October 2017, espoused by the Indian government in 2016, acknowledges the World Health Organization has always emphasized the value of proper rules and regulations for the practice of traditional medicines in their country of origin, as well as for the global accreditation among its member countries. Notes that since the dawn of human civilization, Ayurveda is credited with the distinction of being the first indigenous medical system, accepts that Ayurveda is a means of maintaining good health, further recognizes that Ayurveda empowers patients and restores them as agents of their own health and healing, and urges the consideration of Ayurveda to be included as part of prevention and well-being initiatives of the National Health Service.
Thank you. And this EDN, there's some copies here if anybody would like to take them away, but you could actually, again, it's a political point I'm about to make. It is about asking your members of parliament, are they interested in supporting and signing up to the EDN? And it then will demonstrate how interested parliamentarians are. And if they're not, it allows you an opportunity to actually give them a little bit of an education about Ayurveda. And I suspect not many members of parliament actually understand Ayurvedic practices. If I may now turn to Dr. Etienne Brimden from the Brimden Ayurvedic Clinic, Netherlands.
Okay, I will help you. My name is Dr. Etienne Premdani, not Premdan.
I am absolutely failing miserably this morning.
It's okay, forgiven. Etienne is a French name given by my mother when she was pregnant. She liked the name, it was a French name, it was a French monk. Everybody should know Etienne, Saint Etienne is a monk. Okay, I was born in Suriname. Our ancestors are from India, 140 years ago. I think everybody knows where Suriname lies. It's in South America, in the West Indies. It was a Dutch colony, that's why we speak Dutch. I studied allopathy, but because my father was sick and he had a skin disease called psoriasis, and he told me, just finish your allopathy, but you have to become an Ayurvedic doctor. I had a big ego at that time, and I didn't even know what Ayurveda was. And he was quite angry with me. He banged his fist on the table and said, I want you to become the biggest or the most famous Ayurvedic doctor in the Netherlands. At that time, I was not interested. And his words came true. I'm running an Ayurvedic clinic in the Netherlands, and Dr. Atiq and Dr. Madan came last 2 weeks back. We celebrated the first Ayurvedic day on the 30th of September. It was fortunately also the Sera, so it was a very fortunate day. I also introduced my second book on Ayurveda that day, and thanks to my friend Amarjit Mamra, who did a great job to stimulate me to organize it, and thanks to him we could organize it. It was a full house, and also he's from the all-party parliamentary group on Indian traditional science. Also Dr. Godagama from Ayurvedic Medical Association was there. Dr. Atiq of the College of Ayurveda is my Ayurvedic guru. Thanks to him, I got also the postgraduate from the Middlesex University in Ayurveda. And I also mentioned Professor Tangavalu and Brittany Spence of BCMA. And we have recently introduced the College of Ayurveda in the Netherlands to give the people in the Netherlands a better education in Ayurveda. My only hope is that we should work together with the Netherlands, with the UK people, to make a better platform in the Netherlands. And only because of your help with the UK people, I think we can be stronger in the Netherlands. Thank you.
Thank you very much. And I think that was why the point was made about making sure that missions across Europe were working together so that we could get that collaboration across all European countries. So, ladies and gentlemen, I'll now turn to Gordon Brennan from the British Association for Vedic Astrology. And before I ask Gordon to speak, if I just remind people that on the 21st of November this year, there will be a seminar on Jyotish and Vastu in the House of Commons. I don't know who's chairing it. Our British Chair Sharma will be chairing it. So if you are interested, I'm sure Mr. Bhamra will be able to give you details of that a little later on. Gordon, please.
Well, thank you very much for inviting me. I just want to express the support of the British Association for Vedic Astrology, which is a fairly small but probably rather influential organisation, as other astrological associations have been started in various countries by our members. I want to express the support for the bringing Ayurveda much more into the public consciousness and to give whatever help we can.
Thank you so very much. That was nice, short and brief. And if I may now call on Anna Carla Jedras from Navratopath.
No, right,
Naturopath.
okay. Good morning,
Thank
ladies
you.
and gentlemen. Thank you.
And you're from Italy.
Yes, I practice in Italy. I'm British, right? Just get that straight. Yes, right.
Been given
Well, it
notes.
seems, no, but it just seems the right, to say who I am, right? Yes, I'm a naturopath, and I was trained in Urbino at the Institute for Natural Medicine, and they're very proud that I'm actually being able to say a few words today. I can't be illuminating to all these illustrious people that are here, but I will say this, that the basis of my training was in traditional Chinese medicine, but one of my professors, who's actually my mentor, said, when you prepare your thesis, Anna, you better get back to your roots, because my father is Indian, and study Ayurveda. So it's ironic, really. So I grabbed hold of a few books and tried to sort of delve deeper into the Ayurvedic philosophy, and I found that there are so many similarities with the Chinese traditional medicine. I'm not saying it's the same, but the fact that you look at the person, the practitioner considers a person as a whole. It's not just what he's saying, it's how he's saying it, how he's presenting himself to you. So there's a lot of observation going on when you're doing it in both schools. So I was feeling really at home with this Ayurvedic philosophy. And I mean, I could go on forever, but I'm just supporting what the other doctors and practitioners have been saying, that nutrition is the basis of everything, and that's a message for myself as well. And it's also very personalized. So the famous saying in English, one man's meat is another man's poison, is just absolutely true, I feel. And I won't go on forever, but I'd like to say just these few words, which are from a poem written by a Swami. And I'm going to read, it's only going to take 2 seconds. I'm going to read them in Sanskrit, so you'll just have to excuse what I'm saying, and then I'll say it in English, and sort of give it the kind of feeling and meaning that I want to give it. Because I feel that these few words encompass what Ayurveda is all about, really. Excuse me now for my pronunciation. Sarve bhavantu sukhina, sarve santu niramaya, sarve bahadrani pasyantu, makashit duhu kabhak. Translated into English. May all be happy, may all be free from poverty, may all look upon others with benevolence, may all not suffer. So I think if we could follow a healthy lifestyle as the Ayurveda principles set out, that is what we should be. Okay, thank you.
And we may have less angry people about. With that, we might need to send a bit of this over to the States at the moment. May I call on Dr. Don Brennan from the Maharishi Ayurveda Institute.
Thank you, Baroness, and it's a joy to be with you all and to share with you all our thoughts and our common theme. And our common theme to me from the very start when Baroness suggested that we need to get back in touch with the greater field of awareness which connects us with each other and with the universe. And Professor Porter's individual self-reliance and Dr. Atik's example, and even in terms of digestion, how we need to be broader in our thinking and be more aware from within. And I think every speaker in some ways alluding to it, and the solution is very, 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 very simple. You just empower people. You just give them the information they need. It's called knowledge. It's called the knowledge of life. Everybody's living their life. Everybody's organizing their own physiology. That knowledge of life, that's Ayurveda. Everybody has a human right to this knowledge. They are denied it by a society which is just fragmented in its perspective, which is primarily materialistic in its whole project, resulting in a medicine which is failing us dramatically. Your NHS is collapsing. There are 17,000 beds required just to keep up with the growing population by the year 2022, according to predictions. Consider the doctors and nurses you have to employ to man those beds. Consider the increasing burden of chronic disease of which medicine has not got a handle. Diabetes, arthritis, heart troubles, obesity, where the NHS is failing, and we do not have the resources to continue to fund it in the very narrow, materialistic perspective. We need to give people knowledge. It's very simple. Introduce this Maharishi Ayurveda, for which I stand. All of us stands for Ayurveda, this knowledge of life. Introduce it to everybody. Empower them. There will be far, far less need to go to your doctors. When you know how to take care of your simple colds, your aches and pains, when you realize that the digestive abuse you're giving your own system is the cause of your own pain, when you understand what is my nature, who am I, what suits me. Once I wake up to that, 80% at least of the problems people go to their GPs with, they can resolve themselves. Where does that leave the GPs? The GPs who are trained to take care of illness can now focus on it. They can have more than 5-10 minutes per patient. They can have enough time to take adequate care of the seriously ill who actually need modern medicine. Once you unburden the GPs, they in their turn will unburden the hospital systems. And suddenly the hospitals have the resources to take care of their casualties, to take care of the critically ill, which is their role, and the dying, and the hospice. Coming back to the mysticism. Let me just dissolve this mysticism for you. There is no mysticism. There's ignorance, definitely. And ignorance can give rise to a concept of mysticism. I was fortunate to come to this tradition through the work of Maharishi Mahesh Yogi, who in 1988 met with the foremost Ayurvedic doctor of the time, Dr. Triguna, who was in charge of the All India Congress of Ayurvedans, of about 400,000 Ayurvedans. They sat together and they said, how can we globalize this? And work together for that purpose. But Maharishi's insight and his immense, intense focus was that we should give people the key. Give people a simple strategy to awaken the profoundness of their own innate awareness. And that key was just to allow the mind to quiet. And in that process of settling, the mind wakes up to a profound silent presence which connects us all. It's called consciousness, which connects us with the whole of life, of nature, of the universe. And that technique of transcendental meditation, which he introduced in the late 50s, went around the world. At the time, meditation was considered crazy. And now everybody thinks meditation is a good thing because of the scientific research that was done in TM. And now other meditations are coming up, and they're also useful, but different to the TM also. And they all have their purposes. His other focus was that as we settled within and woke up, that we would begin to be able to recognize the greatness of the traditions of India, which are all the expressions of how that innate field of consciousness orchestrates and organizes life, orchestrates and organizes your physiology. This is your life. Orchestrates and organizes the whole universe by the same laws of nature or principles of organization. And just integrating within ourselves, we come to an intuitive awareness which takes us forward in tune with life. But anybody who meditates, when they take to Ayurveda, they take to it with immense joy, because they recognize, hey, this is me. I know this. I know this. The joy of a practitioner who sits with their patient, and their patient is agreeing with everything they're saying. You're right, I love to be by water. I should be by water more. You're right, I go to bed too late, definitely. Yeah, you're right. And of course, I don't have to tell them what to do. They know it. But Ayurveda provides you with a mirror to reflect back. And every one of us is unique, and every one of us has our own needs. And the beauty of Ayurveda is it trains the practitioner to tune into the patient so that he also can recognize what it is the patient needs, what it is the patient knows they need, and then all he has to say is, for God's sake, will you do it? And it works. They come back. And so many practitioners around the table here now, we have tens and tens and tens of thousands, hundreds of thousands of patients between us who have incredible experiences of the use of this amazing ancient tradition. And this is available and readily available within a few years within this nation. If only the politicians, if only the media, if only the administrators, if only the practitioners all together could just allow people to know they have a natural human right to knowledge, the most ancient, time-tested, systematic, profound, holistic tradition is with us. Let's wake up.
You're all awake. And I think is this our final speaker? Oh, there's a few more, okay. So can I now call on Matthew Aldridge, who's a registered nurse of Manusa?
I work in the NHS. Manasa Ayurveda is an Ayurvedic project I'm doing with the mental health charity Mind.
Perfect.
So yeah, I've been.
I just need to say
sorry.
the name.
But yeah, you got
and
me.
everybody explains everything.
Yeah.
Thank you, Matthew.
So yeah, I'm doing some voluntary work with the mental health charity Mind after having trained in Sri Lanka in a form of it's called Buddhist Ayurvedic counselling and psychiatry. So it kind of combines some of the knowledge about different forms of meditation practices and how they can be beneficial, and also the Ayurvedic knowledge. So we're putting together a program and trialling it with people with Mind, the mental health charity. They're referred from GP practices or secondary mental health care services. And yeah, I've been getting their feedback, and they're really enjoying it. Also working on the mental health ward in the NHS, and I'm integrating where I can some of these things there. And I work on the early intervention ward, so it's 18 to 35-year-olds with the first episode of psychosis. And one of the things I just mentioned earlier on was how when people become agitated on the wards, on the psychiatric wards, often we offer them medication as required. So they can be something like lorazepam, benzodiazepine medications, which calm people down, but they're also addictive. So we have to spend some time then to reduce the dose. But what we can do on the ward, and which we've been doing, is is doing a kind of herbal tea group, so we can do a brief kind of Ayurvedic quiz about the person's sort of habits, how they've been feeling, and then see which herbs we can use, and then blend their own teas together using some of those herbs. And instead of rushing to go for the addictive benzodiazepine drugs, they can then have one of the teas that they've made for themselves. And they're really some people are really proud. Like, I've made these teas. Look at these tea bags I've put together. So they can use that, and it's just a basic thing we can do on the ward, which I think is great, and it's cost effective. It's something that the patients appreciate, and they like to learn about it. And that's an example. But it's the project's Manasa Ayurveda, and that's Ayurveda for the mind. So yeah, it's great. So thanks.
Thank you so much. Speaking, Matthew, what came to my mind was the terrible problems we have with prisons and prisoners.
Yeah.
And it just occurred to me that maybe some of the thinking that we actually need to widen the thought process, because we have thousands of people languishing away, and maybe part of the issue is that they actually don't really know how to get themselves better on the inside. And so I'm going to do the questions and answers after. So maybe please let me put that out to you guys. And the other thing I'd like to say is, please, if you haven't got each other's contacts, it's really important that you exchange your emails, your mobile numbers or whatever, because I think part of it is that we don't walk out the door saying, do you know what, that was a great talk, but. So it'd be really, really important if you can. So if I may call on Brittany Spence from BCMA to say a few words.
Thank you very much. So my name is Brittany Spence. I'm chair of the British Complementary Medicine Association. And I really just kind of want to add on to everything that all of the wonderful doctors and professors and researchers have said today. To bring Ayurveda forward into conventional medicine, into NHS, or however we want to look at it. It's been said taking the mystique out and going into the research, but we also have to look at how the UK, how conventional medicine is looking at that research. And in this time, it asks the question of, does this work or doesn't it work? And Ayurveda is never going to fit into that research model, because it doesn't ask that question. It asks, who does this work for and in what situation? And it's getting the message to parliamentarians, but it's also finding a way to get healthcare to look at the way it's researching differently. We saw a change when the NICE guidelines were making a change to palliative care guidelines, which they ended up changing to the end-of-life care guidelines. And this was a big uproar in the complementary medicine community generally, because they wanted to remove complementary medicine. That was the idea. In the end, they didn't do that, but what was most important was the way that they started to look at complementary medicines within this guidelines, which was actually asking the people who were receiving complementary medicine, as well as their carers, what perceived benefits that they had. And and that was actually used, that research was used to put forward with those guidelines. Now that's quite a big step, really. That's a big step, because that is the biggest hurdle that we see. When we're looking at the placebo effect, as it were, when they're doing different studies for medicine, that in itself really knocks away a lot of complementary medicine, Ayurveda, any sort of, especially if we're looking at the mental benefits from this different way of receiving medicine, because they are looking at just touching or interacting with a therapist can lead to placebo. That is why they like to leave medicine very clinical, very cold and clinical. And so this just that one step alone is quite a big deal. I see that as a very big step forward. We were talking about the money that, how the NHS is collapsing, the money that is going with conventional medicine failing us. We're seeing the chronic conditions, I've heard that said many times, in different parliamentary meetings from different professionals that it is the long-term conditions that are costing the NHS a lot of money. But we're also seeing, when we're looking at musculoskeletal issues and mental health issues, the services that are provided by NHS, they are failing. These are not very high success rates. When they go back and check with patients who received the options, they're not getting good success rates with that. Now, these aren't things that are being perceived as costing the NHS lots of money, but it's failing society. So, I wanted to put that out there. We've talked a lot about nutrition for the chronic conditions, but obviously we know that Ayurveda also, it serves the whole body. It serves the whole spirit, everything. And that is what we need to be focusing on. I think really focusing on that change of remembering, like I said in the beginning, of how conventional medicine is currently looking at studies and finding a way to change that message. Something else I want to add is within the BCMA, we have been discussing putting together a book on complementary therapies as a whole. And something I would like to see us be able to do going forward is to get into the universities and speaking with the GPs, with the medical professionals, and educating them on complementary medicines, Ayurvedic medicine, all of this. It's very important that they have that knowledge. It's whether they accept it or not is one thing, but it's needs to be understood that 54% of the nation who it's not 54% of the nation who uses complementary medicine, but of the percentage that does, 54% of those have said point blank they will not tell their GPs that they are using complementary medicine in fear of being told off. Now, that's very dangerous. I wouldn't be surprised. I know myself, I'm a bodywork practitioner, and I will have some of my clients that come to me and will tell me, I told my GP that I was, seeking your help, and that they were excited to tell their GP because they're getting results. But the GP, even after hearing that they're getting results, will still say, oh, stop that. It's a waste of time, waste of your money, a waste of your time. And they're like, well, I'm getting results, so I'm not going to stop. But you can imagine if any other practitioner said that to their patient about going to mainstream medicine, that wouldn't be accepted. You couldn't say that. But anyways, the point is that GPs need to be at least aware that that stigma is being seen by society. They need to be educated that, understanding the benefits, and whether or not they agree with it or disagree with it, they need to be open to it. So that's part of our plans going forward, is trying to get that moving forward. As you were saying as well, Dr. Atik, with having it into the younger schools with the children, we are seeing more mindfulness going into schools and yoga going into schools, and the younger we can start that and get the public